Hey everybody, thanks so much again for tuning in tonight and for joining us. I am so thrilled with tonight's guest. She is as fierce as they come. She is tenacious, she's kind, but more than anything, she's a champion of progressive policies in our country and trying to make our country a better, stronger, fairer place. Pramila Jayapal, some of you might have seen a quote that I gave about her describing her as working really darn hard. The modifier was a little bit different in that one. But there's nobody that is more dedicated and more tenacious when it comes to taking on big challenges that our country confronts and working day and night to try to actually ease those burdens for folks that are forced to carry them. So she's joining us today to talk about a bill that she and I are introducing called the Medicare Crisis Program Act, about why it's so necessary, what it does, and why time is far overdue and we need it right now. Pramila, thank you for joining us, and here she is. Congresswoman, thank you so much for doing this, and thank you for being here, even though here I think is obviously 3,000 miles away. But just walk folks through what is the Medicare Crisis Program Act and why is it so important?
Yeah, thanks, Representative Kennedy. It's really wonderful to be with you today and also to work with you on all of these issues, especially universal health care, which I know has been a passion for both of us. In this crisis, what we are seeing is 35 million Americans projected to lose their health insurance on top of the 30 million that were already uninsured. And then, of course, we had another 35 million that were underinsured. So in the midst of a global healthcare crisis, we can't afford to have people not able to get healthcare. So the Medicare Crisis Program does three things. First, it says that if you are unemployed and you've lost your insurance from losing your job, then you will get covered through Medicare. If you were uninsured prior to the crisis, and you were still uninsured, then you would be covered by Medicaid. And then finally, it prohibits cost sharing for any program that you might be on, whether it's a public program or whether it is private insurance. If you need testing, treatment, whatever it is for COVID-19, that is all covered. And so those are the three basic elements. And I think what we're saying is it's always been a moral responsibility to provide healthcare to people. But in the midst of this crisis that is causing such devastation, body bags piling up, we've now reached more American lives lost to COVID-19 than during the Vietnam War. And I think that it's our responsibility to make sure people can get treatment and testing and have healthcare during this crisis.
So thank you for that. And I think a couple of points there that are worth kind of stringing out for some folks. One, you referenced the fact that we've now passed well over the 60,000 casualty number for COVID-19 here in the United States. And that 60,000 figure comes essentially in 3 months. The entire Vietnam War was well over a decade. And that sparked and fueled a protest movement that still, to this day, funnels or fuels advocacy for an entire generation of Americans. And we did that in 3 months, right? So the enormity of the carnage that has come because of this virus is extremely hard to put into words from what we've seen over the course of the past couple of months in the United States. But what we've also seen, right, and what you touched on, is the need then to make sure that not only does people have access to insurance coverage, right? Because that's been this big fight and this big push on Obamacare and making sure that everybody's covered. But flesh out for us a little bit about that difference between coverage and access and then cost. Because when you've got a virus, a condition that is putting people on a ventilator, so in intensive care in a coma for weeks on end, it's one thing to say, hey, you get insurance coverage. It's another thing to say, hey, you can go access that, have access to a hospital. It's another thing to come out and say, hey, you did, and here's a $250,000 bill.
Exactly. And I think that this is one of the things that we've been pushing, even as we pushed for Medicare for All, which I'm the lead sponsor in the House, you're on that bill, is people need to understand that access just means that, you can go to a hospital. And there's a lot of issues with access. We do need to address access. Coverage means that you can actually get your costs covered. And for most people, healthcare was unaffordable even before the crisis. And so now what we need to do, and I just saw a heartbreaking story in the paper about one of my constituents who lost both his sisters and his mother in a 3-week period. Now imagine dealing with that kind of grief, and then on top of that, getting a bill for whatever the hospitalization costs were, the treatment costs were. And I think there are many, many Americans who are saying, I'm not going to seek treatment. I just saw a Gallup poll the other day that stunned me in one way, doesn't in another. 1 in 7 Americans say that even if they have the symptoms of COVID-19, they won't go seek treatment because they're worried about costs. So the Medicare Crisis Program says, not only do we ensure that people are covered, if you're unemployed, you're covered by Medicare, if you're uninsured, you're covered by Medicaid, but this prohibiting of cost sharing, it is ludicrous to think that we would ask people to pay for whatever coverage they need, or make their families pay for people who have passed away right in the midst of their grief. So this says you can't cover, you don't have to pay for those costs. Now I want to say something about cost, because when we have the conversation about universal healthcare, we talk about healthcare as a human right. Everyone should have, should be covered for healthcare. It should not be through an employer-sponsored program, because you see what happens, right? When you lose your job, you lose your healthcare. I don't think healthcare should be something that you lose when you lose your job. But the cost issue is significant. We spend almost double what every other industrialized country in the world spends on healthcare. And it is really remarkable because our overall indicators of health are so low. Why does that matter right now in the COVID crisis? Because when you think about the fact that we've had so many millions of people, 75 million Americans who are uninsured or underinsured, delaying treatment, refusing to, buy their prescription drugs because they can't afford them. All of the things that have happened that put people in a much lower health condition. It's not their fault. It's the fact that they don't have access to affordable health care that is guaranteed. And so they develop chronic conditions. We force them to develop chronic conditions that make them that much more likely to get the virus. And so, and all of the racial disproportionality, by the way, that goes along with that in terms of, significant numbers of Black and brown folks having much higher rates of fatality, much higher rates of cases. In Washington State, 30% of our cases, reported cases, are Latinx folks. Milwaukee County, Chicago, 71%, 81% of fatalities, African American in each of those two places, when the percentage of African Americans is so much lower. So this is why we have a responsibility to make sure that everyone is able to get the treatment and testing that they need and not have to pay for it.
And also, on top of all of those arguments, which you make quite powerfully, the just blatant one where if you just want to get down to kind of the brass knuckles on it, it's better for all of us. Because if 1 in 7 people that is experiencing COVID symptoms isn't going to go to the doctor, guess what you're going to do? You're going to spread the virus.
That's right.
And if there is a singular lesson out of this moment in American society, it's that your well-being and your health is linked to mine and mine is linked to yours. Because if I do not go get access to that doctor, if I do not go get treatment, if I'm afraid of what this means because I can't, all they're going to tell me is they don't have medication for it and I can't afford it anyway, even if they did, then I'll just try to go back to work so that I don't face financial devastation. And what are you going to do? You're going to spread the disease to other people. And what's going to happen? This is going to continue to perpetuate. And so it's the right thing to do. It's the cost-effective thing to do. It's the moral thing to do. It's also the self-interested thing to do if you want to actually get in front of a pandemic.
That's right. It's a really important point, because I think that we sometimes want, people not only to agree with us on the end result, but on steps 1 to 10 of how we get there. And I actually am just more interested in getting to the end result. And that is that everybody should be tested. Now, some people who think, for example, that you should not get testing, and this happened in our first CARES Act package, you shouldn't get testing if you're an immigrant based on citizenship status. Not only undocumented immigrants, but DACA recipients and legal permanent residents who have been here for less than 5 years were excluded. Now, even if you don't think that's the moral thing to do, like you and I believe, your argument about public health is so important. If we are going to beat this virus, then we have to be willing to test and contact trace and isolate every single case that is out there, because it doesn't matter if you get it or somebody in a meatpacking plant gets it or somebody in an ICE detention center or jail or prison gets it. But the reality is it doesn't stay limited to that person unless they are tested. You have contact tracing, you isolate them, you provide them with treatment. Otherwise, you're going to be in a situation where wherever that person is, they're coming into contact with any number of people and spreading the virus. And so it is our duty morally, but it's also our self-interested duty if we want to beat the virus to make sure that we are providing that kind of testing, contact tracing, isolation, and healthcare coverage for everyone. That's in yours and my self-interest, as you say.
And that's, I think, you cited some of these statistics from around the country, from obviously starting in Seattle, but then in Milwaukee and in Chicago. So one of the communities hardest hit in Massachusetts is Chelsea, which is largely immigrant. Largely of those immigrants, a large disproportionate share Latinx, but still a number of others too. But high population density, one of the most densely populated places in the state. A high ratio of the state average in Chelsea. Yet those workers are also essential. Right? They are the folks that we depend on in order to make sure those grocery stores are stocked, that our mail is delivered, that there's still the basic structures of society are functioning. Yet those are also the folks that have less access to PPE, that when sick don't have a other extra bedroom where they can self-quarantine in. So it means that they're bringing this home and getting, tragically, grandparents perhaps sick. Maybe it's your little kids that are carriers. Maybe it came from a daycare facility. But the point is that unless we actually take the affirmative steps to provide all of the aspects of treatment that you just said, particularly isolating, so access to testing, no cost sharing on that testing, then access to isolation if you are in fact test positive, all that you're going to do is perpetuate the spread of a virus.
Right. And I think this is really important. There's so many cruel ironies in how this virus has played out, how this pandemic has played out. We talked about the fact that if you didn't have insurance to start with, or you were uninsured, if you were living in an area that had toxic waste sites, if you were living next to highways that have a lot of pollution, you are more likely to have the underlying conditions that lead to the virus. That's one. But the other ones that you mentioned are really important as well. Essential workers are generally the ones who are lower wage workers who are out there doing the work. And many of them, including in the public health system, but if you think about our transit workers, our grocery store clerks, all of those folks are much less likely to have PPE and aren't getting tested for the most part. Most of these folks there aren't safety standards in place, there aren't OSHA standards in place, they're not getting sufficient hazard pay. So even though we thank them and we say we're grateful for their work and we wouldn't be able to stay home if they weren't out there, we haven't actually done the work to pass an essential workers bill of rights, which I know your senator in Massachusetts has proposed and I believe should be a key priority. Here's the other cruel and perverse irony, is that the people who are least likely to be able to shelter in place are those low wage workers. Yep. So, they are also the ones that aren't getting a paycheck, haven't, a lot of them haven't yet been able to get onto unemployment. We haven't talked about this, Representative Kennedy, but over 30 million Americans have filed for unemployment in the last 6 weeks alone. And there's millions more that probably weren't able to get into the systems because the systems were so overloaded. During the Depression, we were up to about 24-25% unemployment, and the economists predict that we're going to get there again. This is a massive crisis. These folks, many of them, were also excluded from some of our relief packages for a whole host of reasons. I mean, college aid that we pass is now being limited to DACA students, for example. And if you're Black, whether you're African American or an immigrant Black, the reality is you're in that category of people that we've denied healthcare to over the years, that we've denied, that are, least able to economically make it. 60% of Americans didn't even have $400 in their bank account for an emergency before the crisis. Now you put this crisis and 3 months without a rent check in front of them, and they're really, really going to be suffering. So everything we do has to take those things into consideration.
So talk to me a little bit here before we wrap up about that reality, because I think what we saw coming out of the last financial collapse, 2008, 2009, is Obama administration that came in, stopped this economic catastrophe, and then tried to reconfigure society to be stronger and better positioned for the future. And one of the big pushes there was obviously on healthcare, right? And so we got Obamacare, although not the Obamacare that he had hoped for and that we had passed because of some of those Supreme Court decisions, particularly around the Medicare expansion, right? But what we also saw coming out of that, I think largely because of the way in which Republicans limited and then blocked President Obama's agenda going forward, was this enormous widening of wealth and enormous historic rates of inequality and inequity across the country. I think your concern, and the one that I share out of this crisis, is if nothing changes, what we've seen here is an absolute economic devastation for working class and middle class Americans, whereas white collar jobs can largely have the flexibility to shelter in place, work from home, do these things that are uncomfortable and disruptive, but can still largely get by reasonably unscathed compared to the rest of society. What are, in your opinion, Pramila, are the steps that we need to take to actually prove, as you said, and Reverend William Barber and I tried to articulate this a bit too last week, the steps that we have to take to prove that essential workers are in fact essential, and to make good that promise and on that wording. And as we come out of this, the structures here that we need to fix, the holes we need to fill.
Yeah. I mean, I think that the pandemic has exposed all of the ways in which structurally America was not doing enough for poor folks, for middle wage workers, and of course for people of color included in those categories. And so my belief is that there are really a couple of things that we've got to do as we think through this pandemic. And the Congressional Progressive Caucus, which I co-chair, which you're a strong part of, we have put out 4 areas that are really important for us to focus on in getting into the next COVID bill, and a couple of principles that overlay them. One being that everybody has to be included, that we can't exclude people for exactly the reason you said. We're all interconnected. If you get the virus, it means something for other people. So that's one. The second underlying principle is that whatever we do has to help strengthen racial equity and economic equity and racial equity. So out of this, we can't be leaving out people even worse than we were doing before. The 4 main areas that we focused on are, number one, guaranteeing paychecks and keeping people off of unemployment, keeping workers tied to their jobs, because we know that for all kinds of reasons, that is the quickest, most cost-effective way to get money into workers' pockets, and to be able to pay the rent, the mortgage, all of those things. But also, if we push people into unemployment, guess who has the hardest time coming out of unemployment? Not for reasons of their own, but because of the discrimination that exists. Black and brown workers always have a harder time finding jobs and getting back into employment. Second, we need to make sure that we're addressing the public health crisis. And that is through a program like Medicare Crisis Act, ensuring that people really have what they need, ensuring that we are protecting the essential workers through an Essential Workers Bill of Rights, and contact tracing, testing, isolation. If we don't have that, we can't get the economy back to work. And then third, making sure that we are really addressing the election security pieces. This is very important. The federal elections are coming up. We believe that should be vote by mail and for federal elections, with an option for in-person voting if we need it. And then finally, really making sure that we're getting relief into the pockets of those who are most vulnerable. So even if we do all of this, we are still going to need some stimulus checks. We're still going to need rent support. We're still going to need housing support, all kinds of things for people who are still struggling because they're not covered by anything else. So those are our 4 priorities. We believe we can get some of these into the CARES 2 package, and honestly, we have to. It's our moral responsibility, and it's our self-interested responsibility to take care of the whole country. Beat the virus. This is not a trade-offs between economic recovery and beating the virus. They are actually the same thing. And so job number 1, beat the virus, keep people home, give them checks so they can stay home, and let's fundamentally transform society as we do so.
And that's, so well said. The basics there should be pretty basic though, right? That the preliminary observation of this is we're being hit with the pandemic. In order to make sure that people can get access to the care that we need and we don't spread it, people got to stay home. That craters the economy. So you need the federal support to keep the economy moving while we get the medical innovation. You figure out which drugs can work, you discover new ones, you work on a vaccine, but you basically try to muddle through this without facing a public health absolute disaster, which obviously we're in the midst of, but it could have been worse. Although we need to make sure we get better, right?
Yeah.
You provide that support for individuals, for families, for small businesses, get them through it. You make sure that you provide support for our healthcare sector. So our hospitals, our community health centers, our frontline workers get the PPE that they need, the testing that we need so that we can identify folks and we can get through this. You provide the election support to make sure that you don't do what Wisconsin did, which said choose between your health and your democracy. And from the part that I always find fascinating from talking with your co-chair of the Progressive Caucus, Mark Pocan, on this is the 180 polling locations that Milwaukee normally has during an election. And that for the election they had there about a month ago, they had 5.
Yeah.
Because they couldn't get the poll workers needed in order to keep those other ones open.
Right.
The voter suppression that comes with that. And you hear a lot of folks that are skeptical of this that say, hey, the voter suppression that, voter irregularities that come with the mail. 1, those numbers are infinitesimal to the extent that they even exist. 2, there's a number of states that already do this and do this well. 3, the idea that we're somehow okay with polling locations going from 180 to 5 and think that all those folks that aren't going to have their voices heard or that's somehow okay is stunning, right? Particularly in the midst of this critical election. And then to say, okay, well, going forward, let's take care of folks so that they can, in fact, re-engage in the economy. That none of that seems particularly earth-shattering to me.
Right. No, that's right. And just on the elections piece, I want to say I'm from one of those states that does it really well. We have a vote by mail system. And, we were first hit, right? The first case was diagnosed here in Washington State on January 21st. Our presidential primary was early March. And actually it was the first time we've done a primary instead of a caucus. And we were kind of worried with everything. How was turnout going to be? We exceeded all expectations of turnout. Did better than we've done in previous years where we had a regular primary. And it was because we had a vote by mail system. Now we had it in place. Everybody knew how to do it. It's taken us, a couple of years to make sure we're really getting out to people in the way we need to. But the reality is that while the pandemic was at its worst here in Washington State, we had a presidential primary with the highest turnout we've ever had. So it is possible we can do this, and we should do it. And we need to provide states not only the mandate to go to a vote by mail system for federal elections, but also the money, $3.6 billion that we believe needs to be distributed to states so that they can make this transition quickly.
Pramila, you are a force of nature. Thank you. Grateful for your efforts and just the force that you bring to all of us, making our country better, stronger, fairer place. Thank you. Thanks for joining.
Thank you. Wonderful to work with you as always.
Thanks.
You all just got a chance to see why Pramila is the champion of change, the force of nature that she is. I'm grateful to call her a friend and a colleague and to have her as the Progressive Caucus Chair and fighting as hard as she does every day to make our country better and stronger. Pramila, thank you, and to everybody else, thanks so much for tuning in tonight. Stay healthy, stay safe, and we'll see you soon.